My name is Mark Letoluo. First of all, I'm a community health volunteer. I was trained by the government to be a volunteer in the community in terms of health services. And again, I am in the tourism sector. And currently, I'm here in Narok. I'm trying to set some things up in Narok. My normal day, I have to, for an example, there are days I set aside. Like today, I was doing vaccination. So in a week, maybe twice or thrice, I'm just within the community. I go to the manyatas, I see the air ventilation, I see if they have toilets, because we champion a lot for toilets and hygiene, washing hands. And then because of the corona season, I have to be in all major barazas and forums. I have to speak up, see that people are keeping social distance, they're wearing masks. And yeah, so my day goes like that from morning up to maybe 4. And then, but for us, it's more of socializing. So I go to Obama, I train them, then we socialize again. Yeah, it's a continuous process. The key challenges that we have here is maternal health care, especially mother-child health is very, very prominent in this side. You've seen that we marry a lot of women, then we have a lot of kids. You go to a home, say they have 10 kids and all of them are delivered. So you can find in a family they've delivered 9 at home, 1 at the dispensary. That is not even the challenge. Delivering is not the challenge. The challenge is preparing to get pregnant, getting the right supplements for the mother, for the woman, and then getting the vaccination all throughout from the 3 weeks, the 6, and then giving the mother the right vaccination always, the tetanus one, until they give birth. Then there are the follow-ups from 6 months to 5 years, then training women on exclusive breastfeeding. So those are major challenges in this community. We are trying to address it. Apart from the other challenge of hygiene, we have a lot of maybe cholera cases, stomach, diarrhea is very common. So one of the challenges that the facility faces is not addressing those key issues. Yeah, so one of the things is our women here, they work a lot. They go fetch firewood and water. So the first trimester of 3 months of pregnancy, some miscarriage. And then even the last trimester of the last 3 months, they also do a lot of work and some miscarriage. But the worst of the worst is getting that phone call in 2 a.m. and then the roads are impassable, so you can't help anyone. There was a day a pregnant mother was delivering, and she delivered along the way. The roads were impassable, so she had to be taken by a boda. But along the way between here and Lulunga, it rained, so she was rained on, and she is just a mother and the child. So it was very challenging. Of course, we know those small first aid things. Maybe the small things that we are taught to tell a mother to place the child in the body, then wrap herself, but it can't help that much. So we have always faced problems in this side. So first of all, in our community, you need to survive as a man. You need to find your own space and fight for it. So you need to be influential in your own capacity. You find that when you go to a public baraza, I usually tell them that I'm an example of the alternative care. Yeah, because there was something we learned along the way, that the sexually transmitted diseases can really affect a pregnant mother. Yeah, so sometimes when you talk in barazas, I give them a point after the other. So maybe in one baraza, I tell them about a quick fact that they didn't know. So they end up admiring. After that, they'll ask me more. Yeah, and again, they like community midwife, community bonoko doctor. So I'm one of the bonoko doctors. When they ask me a question about pregnancy, I'll call a doctor. Yeah, and then ask them something. So that rapport, building rapport, is more or less not in a very straightforward way, but they are getting it. So at the end of the day, they are liking it, and then they're impressing it, because now we can speak about the women's health when the men are there. Yeah, so it's no longer about shame or anything. Yeah.